Greetings, all my relatives. It is a real pleasure to be here on Treaty 6 lands. Wherever I go across the country, I acknowledge the traditional owners of the territories we're in. And they've always been so welcoming and kind and gentle, in spite of all of the things that have taken place between us all. So thank you for welcoming us. Thank you for the prayer. It's really important because the people in this room care. Otherwise, they wouldn't be here. They have an interest in improving the health conditions of Aboriginal people. Expertise and capacity in different ways. And I think it's important for us, our community, to welcome Canadians who have a heart and have a passion for helping others. So thank you to all of you for that. I'm trying to decide what might be useful information. My qualifications are that I'm type 2 diabetic, and I'm very typical type 2 diabetic. I get the diagnosis and I begin to be non-compliant with all of the good advice and all of the good procedures that we're supposed to follow. And it's very difficult for diabetics in our communities to be joyful and to be embracive about what you're talking to and the medicine that you bring, when so many of us live with hopelessness and despair, marginalization. So the discourse between us is not always on the same level. I got to tell you that I spent 11 years in a residential school, and I've been traveling this country for 3 or 4 or 5 years now, and I've spoken to thousands and thousands of Canadians talking about our shared history, the legacy of those schools and the legacy of colonialism and the impacts that have taken place between us. And if we never talk about those things, we can be the best at what we are in this room without moving the yardsticks forward, because the divide between us all, with Aboriginal population and all other Canadians, is so distant. So what have I learned in all the time that I've been engaged in the residential school file? 20 years fully now. I sat with the Prime Minister, former Prime Minister, when he made his apology, before he made it, with 3 other survivors. I was co-chair of a planning committee that created the idea of the Truth Commission and advocated it to the Assembly of First Nations and churches and survivor groups. I've been involved in all of that. And it's been important because I learned something, and Canadians are learning something across this country now that we either didn't know or we chose to ignore. And what I've learned about all of that history and its impacts on our current relationship is that a disease, diabetes, has a direct correlation between that history I'm talking about and our health condition. A direct correlation. I've seen some of it already referred to in the presentations. And so it's critically important not to ignore that history, to continue to want to learn all that we can about it. Otherwise, we'll be doing the same thing over and over again. And 50 years from now, the problem will be getting worse. So you and I need to have a discussion. We need to have a dialogue that transforms our understanding of each other. We see each other in different ways. We see and recognize our common humanity. Until we do that, you might see me through this window of being a subjugated Aboriginal person in this country who is powerless and can't do anything about his condition. That's what's happening in this country, although right now in this moment we are in an era of transformation. Right across this country, coast to coast to coast, 2 national surveys have said that 8 out of 10 Canadians want to reconcile with Aboriginal people, and this includes health status. How do we, with your help and others, reconcile our health status? So my day job, of course, is working on reconciliation, so it's really important. Well, I think for starters, that if you belong to an organization, whether it's Aboriginal or government or pharmaceutical or whatever it is, you ask yourself, what do I do differently this time? So when we're in this era of reconciliation, I think it's important for all of us to embrace the core value of reconciliation. That it's not just a silly little topic, that you're going to continue doing what you've always done, and you don't really get to know your patient or your client. No, you think about it deeply, create it as a core value for your organization, and then you create a framework, a text, a narrative through which you act out this reconciliation. I think it'll be really important for the people doing this work and the Assembly of First Nations to see and adopt that core value and to create those plans out of a notion of reconciliation. Otherwise, we're going to be here 50 years from now, and you're going to be 50 years older, and we're still going to be falling behind and not getting on top of this epidemic, this pandemic that's happening. We can't afford not to begin to move forward. So that's what I've learned. Indigenous health actually is a perfect storm just coming at us. Other health conditions are just as grave, and we so need to develop relationships with each other so that we can begin to coalesce our energy and work together, plan together, hold each other up, support each other, so that we're responding in the right ways. I think it's important for me to say this, and I say it with all respect, that the health conditions that we currently have in Aboriginal communities has been driven by a deep layer of racism in our country among the population for 150 years. And I think that as professional healthcare workers, and you work with all kinds of groups, you need to examine your own attitudes, your own perspectives about the people you work for. They, like everybody else, just want to have a sense of dignity and be respected and be seen. And when you do that, they're going to respond in different ways to the requirements that they need to meet to maintain their health or to manage their health. I just want to share some history, and I'm going to borrow from the Truth and Reconciliation Commission report, because I know that not everybody in this room has read that report, nor will some of you ever. But I want to read it because it's so profound. In the opening paragraph of the Truth and Reconciliation Commission report, it said these things: forever, for over a century, the central goals of Canada's Aboriginal policy were to eliminate and cause Aboriginal people to cease to exist as distinct legal, social, cultural, religious, and racial entities. Let's think about that for a moment. We're Canadians all together here this day. What if some outside external entity came in and they were going to do all these things? What would you think? What would you feel? What do you think the outcomes would be? The establishment of and operation of residential schools were a central element of this policy, which can best be described as cultural genocide. I remember when I first heard that, I thought, oh my God, in this country, free, democratic, caring, inclusive, believe in justice and equality, and somebody just said, we have effected cultural genocide against the Indigenous people. The report went on to say that Canada set out to destroy the political and social institutions of Indigenous people. Think about that again. What if some external party came to our country now and began to destroy those things? And they did so by seizing lands, forcibly transferring populations, restricting movement, banning languages, persecuting spiritual leaders, forbidding spiritual practice. All of those things they did. Families were disrupted to prevent the transmission of cultural values and identity from one generation to the next generation. The Canadian government pursued the policy of cultural genocide because it wanted to divest its legal and financial obligations to Aboriginal people. They wanted the land and the resources. Given the catastrophic evolution of events, it's no wonder that the people, some of whom are your clients, have no self-esteem. Do any of you know what it's like to live without self-esteem? No self-respect, no sense of value or purpose. Do any of you know how to live with those things? It's debilitating, and it's crippling, and it's sustaining, and it destroys your soul. So when we're here together, we're all good minds and we're all good hearts. We need to have a deeper appreciation of that history so that we can truly and deeply apply ourselves to the things that we need to do to improve the health status of Aboriginal people in this country. So further to the commission report, they did make some recommendations, and I think they're important to quote one or two of them. And in the calls to action by the Truth Commission, they said, we call upon the federal, provincial, and territorial and Aboriginal governments to acknowledge that the current state of Aboriginal health in Canada is a direct result of previous Canadian government policies, including residential schools, and to recognize and implement the health care rights of Aboriginal people as identified in international law and constitutional law and under treaties. Another call to action, 19, we call upon the federal government in consultation with Aboriginal peoples to establish measurable goals to identify and close health outcomes between Aboriginal and non-Aboriginal communities. So such efforts would focus on indicators like infant mortality, mental health, suicide, addictions, life expectancy, birth rates, infant and child health issues, chronic diseases like diabetes, illness and injury incidents, and the availability of appropriate health services. And I just want to read one more call to action. We call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centers to address, and this really describes the degree and depth and width of the harm that Aboriginal people have suffered in this country as a result of colonization, healing centers to address the physical, mental, emotional, and spiritual harms caused by residential schools, and to ensure that funding is sustainable. We call, and this is for us, we call upon those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in treatment of Aboriginal patients in collaboration with Aboriginal healers and elders were requested by Aboriginal patients. You know, one of the things when I travel and I talk everywhere to other people is that we always, because nobody really has understood the disparity, the width and depth of the separation between us and the harm that causes, I always want to remind them of some of the current realities in Aboriginal communities. Canada ranks consistently high on the United Nations Human Development Index at 5. But if judged solely on economic and social well-being of Aboriginal people, we drop to 48. That's that's horrible. That's tragic. And in a rich country like ours, the life expectancy is 3 to 6 years lower. We are 4% of the total population in this country, but our jails are filled with nearly a quarter by Aboriginal people. Indigenous children are more than twice as likely to live in poverty. First Nations people aged 45 and older, so that's me, and older have nearly twice the rate of diabetes as the non-Aboriginal population. First Nations people are 6 times more likely than a general population to suffer alcohol-related deaths, and more than 3 times more likely to suffer drug-induced deaths. And one of the most tragic incidents that we see almost daily across the country, the overall suicide rate among First Nations communities is about twice that of the total Canadian population. So those are all staggering statistics. Aboriginal youth between the ages of 10 to 29 who are living on a reserve are 5 to 6 times more likely to die by suicide than all others. The state of Aboriginal health really, really is frightening. And it is, if you're in it like I am, or it's a nightmare for everybody else. This country, we've got experts going around trying to figure out what the heck is it that we're doing, and we can't really get caught up, and we can't change too much. We do all that we can, and I want to be very respectful. I think Western medicine has done all that it can, and Western medicine is beautiful, and it's powerful, and it's needed. But I'm just saying that in spite of all of that, nothing really has changed. So what I'm saying is that we have to revisit this issue and regain some additional or new perspectives on about how we wrestle with all these health conditions. We know, like I mentioned earlier, that residential schools endangered the health and well-being of children. They were exposed to infectious diseases like tuberculosis, physical and sexual abuse, the loneliness from separation from families and communities. You know what's the worst thing about all of this history? Is that intergenerational trauma. I'm not as old as some of my friends here, but I'm old now. And my kids and my grandkids are still being affected by the experience that I had in those residential schools. And so we have to keep that in mind, and we have to know those things when we wonder, how come this Aboriginal patient isn't listening, isn't complying, isn't doing anything with his diabetes when I've told him everything I know and give him the most potent medicine in the world? How come it's still a losing battle? And it always comes back to relationships. If you are in the Aboriginal community, working with Aboriginal family, or wherever it is, I think the most important thing that you can do to shift the dynamic that exists right now is to develop those relationships. And I think the next important thing that happens when you develop those relationships, when you give credence and honor to those patients, is that you empower them to want to be involved and to own their own health condition. That's so important. You've got to do that. You've got to spend time doing that. And it probably costs the least amount of money to begin to develop the relationships that create empowerment for Aboriginal people to be accountable, to take care of themselves in ways that they can. There are many ways, and I know that all of you in this room have heard in part or all of it, the ways that Aboriginal people see the world. They're old world views, and they have a lot to do with the sanctity of creation, the connectedness to the environment, to the world around us, to animals, to the birds, to the fish in the seas. We are all one. And if we believe that, and we begin to exercise that respect for this notion, we're going to be healthier. We're going to be more empowered. We're going to feel connected, and we're going to feel inspired, because for some reason, most of us who grew up in those residential schools felt we were nothing and nobody of no value, and when suddenly we discover this new information, it's going to reignite the notion of my own humanity. I'm going to start to respect myself, start to love myself. I know in this profession you don't probably sit around a table and talk about love very much, but it's really, really, really important. Take a moment to say, what do you think of love? How do you practice love? How do you create love? How do you energize love between people? And that won't cost any money. But suddenly you're elevating the spirit of patience, of people you know, just by telling that they are important, they're valued, they belong, they're connected to all of us. With all of the communities and all of the diabetics that you work with, you're connected. And I think the best way to be connected is to understand each other. Recognize the context, the narrative, the framework upon which you are connected, and begin to define what are the benefits for being human, of acknowledging each other, of being compassionate, caring, loving, so many things we don't talk about. When I was thinking about coming here to talk to you, I really didn't know who I was talking to. I was hoping it was you. I didn't want to meet all kind of government people. We've failed tremendously at government to government thing. But I wanted to see change that can happen now. Change that be persuaded by your own power. As individuals with your experience and expertise, you can bring hope to diabetics, hope to other people. And so I know that you know that there are many ways that Aboriginal people see health responses as well, like being back to the land. I hear about that all the time. Bush healing camps, sweat lodges, traditional policies, water and cedar baths, smudging, other spiritual practices. And we're now beginning to learn, and I know that you know this already, that best practices for Aboriginal wellness involve a range of services from mainstream healthcare. Nobody's saying you're bad. Nobody's saying that's bad. We're just saying we got to have some additional approaches to change the way things have been, because obviously it hasn't been quite enough, right? So we love you. We want you to be involved. We want you to bring your programs. We just want to do it differently. We want you to connect eyeball to eyeball, heart to heart with the diabetics in our community. Such an integrated approach has the power to improve the lives of community members. So because I came here under the auspices of Diabetes and My Nation, and my friends are there, and they're Dr. Keith and Nishem. So we have this little project called Diabetes and My Nation. And what's important about Diabetes and My Nation is the idea, like I said earlier, that our approach in the first instance is to create relationships with the diabetic, with his family, with community, and other healthcare givers. So these relationships must be developed, increased, and when you do that, understanding and trust evolve, right? Relationships are a cornerstone to inclusivity, are essential to support systems, are paramount to networking, are conducive to the development of best practices. Relationships create potential for innovation, for out-of-the-box thinking. And of course, like I said, empowerment. One must be responsible for his or her own health condition. That is to say that they understand their condition, that they're involved in the design of the remedy, that they are committed to medical and remedial plans. In the case of a diabetes patient, they must understand that beyond medical personnel and prescriptions, they need other forms of support. So at Diabetes in My Nation, we solicited an inclusive and holistic approach when dealing with diabetics, their families, and their communities. First, we followed long-standing protocols. We went to speak to the hereditary chiefs. Then we consulted with the band councils. And then we consulted with elders and with the community. And we brought in the experts, Western medicine professionals, because we knew nothing would change without all of us working together. I've never been a professional. I've never been a doctor or anything. And I may be wrong, but I've always had this assumption that all of you operate in silos and nobody should really disturb that. But I think what we should do is begin to integrate it together so that you see each other and you know that there are going to be better outcomes because you see each other and you're willing to compromise and work together to change outcomes for patients. So here we are in this room in this time. We are in a new era when it comes to Aboriginal health. We are recognizing the impacts that I spoke about before of our shared history together, of colonialism. Somebody was supposed to give me a signal when I'm getting close to the end. What? I'm not done yet, but fine. Okay, thank you. We are recognizing those impacts, the sum total of that experience, and we've experienced a deep sense of oppression. We have that, like I mentioned earlier, a lack of self-worth. We have no power or authority or value or purpose, like I said. When you grow up in that, it's very difficult to be inspired to want to be part of anything. Leads to depression, suicide, compounding health conditions. But I think that in this time, when we bring ourselves to this table and you're searching diligently for new ways to move forward together, supporting each other, that we're going to make a difference. We can make a difference. Everybody in this room and all of those beautiful people at home who are working as hard as all of you to improve the quality of life for Aboriginal people. So I'm just going to close by saying that relationships are important, empowerment is important, trust is important, integration of services is important, inclusivity is important, that you have strong networks, strong family and community support, health best practices are better, and it really does lead to a change in the way people live out their lives. I want to close by saying that it's going to be really important when you leave this place to go back to your organizations or your communities, that you help people begin to understand what reconciliation really means. It's not just for social purposes or economic purposes, it's for spiritual, emotional, people-to-people purposes. We've got to create this lens. We've got to adopt this core value of reconciliation. And I hope I didn't offend anybody. Sometimes people roll up their eyes when I start to talk about residential schools. I hope I didn't do that. But we can't afford not to talk about these things. Many people say, why don't you just get over it? Well, we can't get over it. One day down the road, it might be your children that somebody comes for if we're not diligent and we don't care and caress and nurture the relationships that we're developing now. Thank you, all my relatives, for listening to my words today. Thank you.